So first of all, thank you very much for inviting me. And although at first time you invited me, I was thinking, what can I share that could be useful? Because I'm not very satisfied with what we have done about infodemic management. So I was just planning to complain all the time about what went wrong. And the initial title of my presentation was the great failure of infodemic management in Serbia. But then I said, okay, let's try to find something positive also to talk about. So I'll try. I'll try.
Well, Stefan, I think we all have our struggles, and I think we can all learn some things from each other. We're very excited to hear about your ups, but also about the downs, because I think
You'll
we're
learn about the
familiar with that.
struggles. That's for sure. You'll learn about the struggles. So I will talk a little bit about the epidemic and infodemic in Serbia, how it was at the beginning, the first, second, third, fourth waves. I don't know how many waves we've had. What were the changing, how the environment changed and the narratives. What were the different phases and how we addressed different populations in different ways. And again, I'll try to give you maybe some shortcuts or maybe some ways not to waste time the way we did at some point. So just a quick note about Serbia. So it's a landlocked country with a population of about 7 million people, and we've had actually several waves of the epidemic in our country, and I have divided the periods more or less by the narratives and what we were talking about indeed. So it's not about the waves. It's first thing that I will show is what was before the beginning of the pandemic. Then in the first two waves, you can see very flat waves that we had in 2020, and then at the end of 2020, two big waves that are just the last one is just calming down while we are speaking. And just so you know the situation at the moment, we have around, so maybe a bit more because this was from the 16th of May, but around 4 million doses administered in Serbia. I will also tell you a bit about myself, just so you know where I'm coming from. As you said, I graduated from the Faculty of Medicine, so I'm a medical doctor. I did a PhD in Milan in occupational medicine and industrial hygiene. My collaboration with the University of Milan has proven very important. As I will explain, I had double information. So I had all the information from Italy, and we were around 2 or 3 weeks behind Italy in everything that was happening in Serbia. So this was a big advantage that, again, we failed to use. But this is something that could have helped us a lot in what we were doing. I was a member of the working group for the protection of health workers in the Ospedale Santi Paolo e Carlo in Milan, and also a member of the American Conference of Governmental Industrial Hygienists and their pandemic response task force. So I was lucky enough to have a lot of exposure to quality health information, and you will see how we try to distribute this. And of course, I was lucky enough to become an infodemic management unicorn. So from just a regular know-it-all and a person that bores everyone at family gatherings, telling them what's wrong, what they didn't understand about science. Now I have a certificate and I can say that this is my job and this is why I do it, not because I like to do it. And this is something that annoys my wife a lot. But I say, I have to do it. It's my job. So this. I want to thank Tina and Neville and Chris and all of the WHO group that helped me become what I'm and to do what I'm doing now. So how the pandemic started, I want to start with how wrong I was and how it's okay to be wrong when there is an evolving situation such as not seen in 100 years global pandemic. In around the 14th of February 2020, I was in Milan. I was waiting for a train with some of my friends, there, and we were discussing the new virus that appeared in China. And one of the friends were saying, yeah, it's a serious thing. I have a friend who came back from China last week, and he's now in the office, and he doesn't want to wear a mask. And we were actually laughing at his concerns, because it seemed like something very distant. We went into the train, and this conversation ended as if he was worried for no reason. And just a few weeks later, my Italian colleagues know, just a few weeks later, there was the first case in Italy, and then first several cases, and then there was growing concern also in Serbia. And some of the initial misinformation that came with this. So this was our preparation for the epidemic, and the preparation for the epidemic was that this is a ridiculous virus, that the epidemic in China is ending, that it's no difference than SARS or MERS, and we know that we didn't have any effects of SARS and MERS in Serbia. The virus is losing its strength, so these are some of the things that soon there will be more sunlight. So it was February, March, it was already warm, so with the sunlight we will have more vitamin D, and the immunity will protect us. There was no reason to wear a mask. There was even claims that women are protected, that the young people cannot get infected. So this is our starting point. And what is strange is that when I do some low tech, just direct discussion with some people that don't want to get vaccinated or are not covered by our usual online surveys, they usually repeat all of these things, although it's 1.5 years later. So it's really, for me, it was strange. The good things about this initial various information that was around at the beginning of the pandemic was that the message was that there is no reason to panic. So I don't mind this message. Again, this is one of the first times I heard a call to ignore Facebook and unreliable information, although this call came from a person who later continued to spread unreliable information. So this person was against unreliable information when they were calling for panic, but he continued to spread unreliable information that I am showing on the left throughout the pandemic and the epidemic in Serbia. But the good thing was that there was no reason to blame anyone, so there was no stigma against Chinese people, against any kind of people that were traveling. So this was the good. The bad was that this first information stayed with our population until today, and we are still fighting with a lot of what was heard in the first days of the pandemic. And this is the ugly. So this information has continued to circulate, and what I'm referring to here, a lunch with anti-vaxxers. I recently had an encounter with people who just came to me and said, we heard you talking about the vaccines. I was promoting vaccines, and we are anti-vaxxers. And then they started explaining, and I appreciate they wanted to share why they are against vaccines and why they don't believe. And really, they were just repeating the same misinformation that was available 1.5 years ago. So their attitude has not changed through it all. The state of emergency in Serbia started in March 15th, and the lockdown, so complete lockdown in March 18th, and it lasted for 2 months. During the first and second waves, we had a lot of misinformation about the origin of the virus. Is it a virus? Is it dangerous? Should we wear masks? Which ones? Why? Should we wear gloves? There were a lot of claims about nutrition, so that nutrition is enough to stop the virus. Various fake cures and preventive means. One of the big problems was who should wear a mask, and there was a problem of leading by example. So a lot of the people that were in charge of the pandemic response did not wear masks when they made any kind of public appearances, or they wore masks similar to what I'm showing in this image. So different ways to not wear a mask correctly. I want to underline an example of this person. So it's an immunologist, a medical doctor, who was maybe the only person in the response team who always appeared in public, on TV, in various meetings and conferences, wearing a mask, even in the situations where, similar to the current situation, the messages coming from the government were that we are now close to the end of the pandemic, everything is going back to normal, everything is great. So there were very positive examples, and these people allowed us and other people to say, okay, I agree with this attitude and I want to do the same thing. Our infodemic efforts at the beginning were addressing health workers. For the second wave, there was a period where the misinformation again came about. There is no need anymore to wear a mask. The virus will disappear during the summer. It's getting weaker. It cannot cause serious illness. So all of this wrong information was circulating. Not these claims were made not by some random people, but by people who were following the epidemic and were considered the voice of epidemic response. So this was a big problem. And just as you would expect it, after 1 or 2 months of very loose behavior by the people, we had another surge in cases. Then in the third wave, we started getting a higher number of cases every day, more hospitalizations, more people on respirators. So now we are coming to these two big waves that we had. Unfortunately, it was just the moment when everything was returning to normal. But as the weather worsened in Serbia, people stopped spending more time outside and started spending more time inside, started closing windows in different rooms where there were large numbers of people. And also this is the time when the infodemic management training came, and this was really a great moment because it helped me and my colleagues kind of find a framework for what we were trying to do in different parts of the epidemic in Serbia. And finally, the fourth wave that we are hoping is now calming down in Serbia. It's the age of the infodemic management and of course of the vaccines, because at these moments in Serbia we have enough vaccines to vaccinate any interested person. As you probably know, also a lot of people from other countries are coming to Serbia to get vaccinated, not only from the region but also from from Italy. I think Luca Vacci, he came to get vaccinated in Serbia, and it was a big media hit. So on one side, we have vaccines available, but unfortunately, the interest for the vaccines is getting very, very low. And from the initial interest, where around 1.5 million people applied to get vaccinated in the first week when this was available, most of these people, of course, got vaccinated, and now we're seeing this slowing down of the vaccinations, and you can see here some percentages. So in the younger populations, very low, 5.5, 20%, 32%. Then in the older populations, maybe a bit better, around 50 and 60%. And what's worrying is health workers. And this is the percentage of health workers that have been vaccinated. So this is what's worrying us now. So
You have
I'll
about
tell
2
you.
minutes left. Thank you.
Okay, so quickly to tell you about infodemic management activities. In the first wave, we discussed how we can protect the health workers, and we did that by showing some examples from Italy, some research that we did together. We also did some research by ourselves in university students about health literacy, and what we saw in this research was that the health literacy score of university students in Belgrade was 3.16 out of 4, and how they measure reliability of information was 2.9 out of 4. So there was room for infodemic management activities. We did some webinars with employers, but our problem was that employers usually thought or that they did everything they could, or that nothing could be done, or that the infodemic is of no concern. Finally, we did a lot of webinars. We tried to inoculate a lot of people by doing these open webinars and discussions about how misinformation can influence our choices and make us make wrong choices. We made TV and radio appearances, and we also gathered some experience from other colleagues which did vaccination-related activities. So the Faculty of Pharmacy, for example, made a guidebook about vaccines to answer some of the questions that were current at the moment. And the students of the University of Belgrade, Faculty of Medicine, and other universities did volunteer work discussing with other students why they should get vaccinated and answer the questions. Just to sum up, the apps of infodemic management in Serbia, they were that Serbia is a relatively small country, so it's relatively easy to get in touch with different experts from different institutions, and most of the population uses Facebook, so more than 60% of the population, so there is no spread around different networks, so it would be easy to reach people. National media is ready to support government efforts, but there need to be government efforts to support them. It was easy to contact the media, and it was quite easy to contact the professional organizations, and they were interested to support these kind of webinars and discussions about the infodemic and how information can influence our choices. But the reach of these events were in my opinion, very low. Now about the downs. Infodemic management and the infodemic is not recognized as a priority, so the influence of the various information is very underrated. It's difficult to talk to stakeholders and decision makers because they are reachable, but they mostly ignore any outside influence. There are big political challenges. So what is a priority? Is it scientific? Is science the priority or politics? If something scientific will bring a damage to the politics, are we going to do it or not? There is very low media and information literacy, so this is one of our problems, and still there is no official body or team working actively on infodemic management and different things that go under infodemic management. We are working on some future steps, which is to recontact all relevant institutions. We'll do this during the summer. We are developing a health information course for journalists and biomedical students, hoping that they will do some peer pressure and peer education on their fellow students. We are developing a low-tech social listening method for Serbia, and working on community engagement in several communities which were struck really hard by the epidemic, and of course some research on vaccine hesitancy in Balkan countries. Thank you very much.